Good morning, good afternoon, good evening to you all, and welcome to this COVID-19 virtual press briefing and Facebook Live event. Thanks very much for joining us today. The topic today will be older populations and COVID-19. As you can see, we're here in the UN building, in the UN City building in Copenhagen. I'm joined by the Regional Director, Dr. Hans Kluge, who will be making a statement shortly. We are then going to move to a panel. That panel is made up of Alana Officer, Catherine Smallwood and Manfred Huber, who I'll introduce a little later for the panel discussion, where we will endeavour to answer your questions and assure that we come to responding to the queries that you have posed in advance and also during this virtual press briefing. So thanks again for joining us today. I'll immediately hand the floor over to Hans to say a few words.
Thank you. Thank you for joining us. Since I last spoke 1 week ago, the number of laboratory confirmed cases reported across the region has doubled to 464,859 cases. Europe, together with North America, is now the epicenter of the pandemic. Many countries, particularly in the western part of the region, are now seeing widespread community transmission. Italy, with over 105,792 reported cases, and Spain, with 94,417 cases, have now surpassed China. France and Germany also have a considerable number of reported cases at 67,366 and 52,128 respectively, with other countries close behind. Clearly, there are huge differences between countries, the burden of COVID-19 on societies and economies, and the measures being implemented across the European region. There is a huge amount of data on COVID-19, but nowhere that member states can find out what health systems are actually doing and whether it's working. Here at the WHO Regional Office for Europe, we are stepping up to capture what is happening, to support countries, to organize their thinking and planning, to share the information and evidence with policymakers through the COVID-19 Health Systems Response Monitor. This is a new platform which WHO Europe has developed and will run with the support of the European Union and the European Observatory on Health Systems and Policies, and will be updated regularly to inform and support policy decisions at various stages of the pandemic. It will be launched today on our website, accompanied by a press release at 12 o'clock Central Eastern Summertime. The majority of those who are infected with COVID-19 have a self-limiting infection and do recover. However, we know that a minority go on to suffer more severe disease, with 10% of cases requiring intensive care unit admission. Sadly, some patients will pass away. So far, 30,098 persons are reported to have died with COVID-19 in the European region, with 90% of the deaths occurring in the mainly affected countries of Italy, Spain, and France. Older adults are at a significantly increased risk of severe disease following infection from COVID-19. This is a very important observation from the European region. Of the top 30 countries with the largest percentage of older people, all but one, Japan, are our member states in Europe. The countries most affected by the pandemic are among them. We know that over 95% of these deaths occurred in those older than 60 years. More than 50% of all deaths were aged 80 years or older. We also know from reports that 8 out of 10 deaths are occurring in individuals with at least one underlying comorbidity, in particularly those with cardiovascular diseases, hypertension, diabetes, but also with a range of other chronic underlying conditions. Today, I have 3 key messages for you regarding COVID-19 and the need to protect, care and support older populations. First, we should emphasize that while older people are at highest risk from COVID-19, all of us at all ages need to act in solidarity to prevent the further community spread of the virus. Some of the reasons older people are greatly impacted by COVID-19 include the physiological changes associated with aging, decreased immune function and multimorbidity, which expose older adults to be more susceptible to the infection itself and make them more likely to suffer severely from COVID-19 disease and more serious complications. But age is not the only risk for severe disease. The very notion that COVID-19 only affects older people is factually wrong. As a colleague of mine recently said, young people are not invincible. 10 to 15% of people under 50 have moderate to severe infection. Severe cases of the disease have been seen in people in their teens or 20s, with many requiring intensive care and some unfortunately passing away. On a positive note, there are reports of people over the age of 100 who were admitted to hospital for COVID-19 and have now since made a complete recovery. It is becoming clearer that the healthier you were before the pandemic plays a crucial role. People who age healthily are less at risk. For those in self-quarantine or working from home office, it is important to maintain a healthy lifestyle with good nutrition, physical activity, and staying away from tobacco and alcohol. The focus to contain the pandemic may result in the disruption of routine health services, interruption of the medicine supply, confining of patients, and deleting social and public services which impact people suffering from chronic conditions of heart and lung, diabetes, or with immune systems which are weak, including from cancer treatment. That's why I am urging governments and health authorities to mitigate the effects of service disruption that may harm people with underlying chronic disease and disability. Policies for healthy aging have to stay high on our policy agenda. The figures make a clear case. Protecting yourself and those in your family and community from getting infected is relevant for every single age group. It is not only an act of solidarity with others, in particularly with those most likely to be severely affected, but also vital for your own health and safety. So my first message, this relates to older people, but also all age groups. My second point is on the importance of supporting all health and social care workers equally and giving special attention to those who provide nursing and social care service for older people, leaving no one behind. WHO continues to stress the importance of protecting healthcare workers. 10% of the COVID-19 patients are healthcare workers in our region. They must be supported with the training and resources they require, including adequate personal protective equipment. This is equally important for those providing health and social care to older people living in their communities or in long-term care facilities. These are our colleagues who care for those who are among the most vulnerable, people with frailty and those living with dementia. Let us not forget that already prior to the COVID-19 pandemic, many health and social care workers who provide long-term care have been working in challenging conditions with few resources, whether in the community or nursing home facilities. I am also encouraged here to learn of efforts made in Ireland and Belgium on this front. For example, in Ireland, a national call for retired healthcare staff, doctors and nurses to return to work was made. The Be On Call for Ireland initiative was launched by Prime Minister Varadkar, and they received 24,000 applications in 3 days. Incredible solidarity. In Belgium, through the Flemish Older Persons Council, Vlaams Ouderenraad, despite the increased workload, nurses are still taking the time to arrange communication between residents and their relatives through phones and social media apps to foster contact and stay connected to reassure everyone. First message, it relates to all age groups. Second message, protect the health and social care workers. And thirdly, supporting and protecting older people living alone in the community is everyone's business. I am reminding governments and authorities that all communities must be supported to deliver interventions to ensure older people have what they need. This support includes safe access to nutritious food, basic supplies, money and medicine to support physical health, and access to social and mental health support and information to staying emotional well-being. All older people should be treated with respect and dignity during these times. Remember, we leave no one behind. Many authorities in Europe now urge older people to stay at home for an extended period of time in self-isolation, otherwise called shielding. In particular those who are immunocompromised or have chronic conditions. For them, we need to secure updated care plans, defined pathways for accessing services, surveillance of their compliance with prescribed medicines, supplies and equipment, transportation and support for self-management, access to rehabilitation and palliative care as needed. Overall, it is crucial to ensure we stay connected. A message for our younger viewers: if keeping your grandparents safe means you cannot visit them in person, talk to them. Talk to them every single day so they don't feel alone. Physical distancing is not social isolation. Make sure your grandparents understand the information which is put out endlessly on the media, that they stay and feel informed, equipped with the right information and engaged. The Spanish Red Cross, which has more than 200,000 volunteers in more than 1,400 towns, has launched an information campaign aimed at 400,000 people identified at risk, including older people and those with chronic diseases. Over in Ireland, local level sporting clubs, community groups and others are telephoning local older people regularly, collecting their shopping and dropping them at the doorstep. These daily check-ins have been an invaluable support to thousands across the country. If you feel your community needs support, now is the time to step up. I urge you all to take bold action, create societies and caring environments that foster healthy aging, something all of us deserve in peacetime and wartime. We will emerge from this pandemic, having paid a high price, battered and bruised, but more resilient and ready in the future. Thank you for your attention.
Thank you very much, Hans, for that opening statement and those words. So I'm going to open up the panel discussion now based on the questions that we've received from the press and for those of you who are joining us on Facebook. We have joining us on the panel alongside Dr. Hans Kluge, our Regional Director. We have Alana Officer, who is the Unit Head for Demographic Change and Healthy Aging from Headquarters. Welcome, Alana. We have Manfred Huber, the Regional Advisor for Healthy Aging here at the WHO European Regional Office. And we have Catherine Smallwood from our Incident Management Team of the Emergencies Programme here at the WHO European Regional Office. So, Catherine Smallwood, Katie, I'm going to turn the first question over to you, and I'll just read it out. It's a rather long one, I'm afraid, to start with. But we know that older people are at high risk from COVID-19, but the media are reporting more and more about younger people, including children and those without underlying health conditions, dying as a result of COVID-19. Will the majority of people experience mild symptoms, or are we now entering a phase where everyone is at risk or dying from the virus? I think the Regional Director responded to some of that already, but Catherine, Katie, can I hand it over to you, please? Thank you.
Thank you very much, Rob, and thank you, RD, for your very wise words. And indeed, this virus is a new virus in the human population, and it affects the young and the old alike. But based on what we know, the virus can cause a range of severity of diseases, from very mild disease to flu-like symptoms, as well as more severe disease. And it's clear that the risk factors, i.e. the factors that really determine how ill that we will get, are based on older age and the presence of underlying medical conditions, comorbidities, as our RD described. There are, of course, exceptions to what we see in the normal trends, but we do have quite good understanding now based on both the information that's come from China, but also from other contexts. And there we do see that most people will have a mild disease. That's 40% of cases will have a mild disease. 40% may go on to develop pneumonia, but only 14% will really progress to severe disease requiring hospitalization, and 5% will be requiring critical care and intensive care in hospitals. So we do know that these are the overall trends. No, if everybody gets the disease, it does not mean that we will be dying. The virus is not changing in terms of how it affects us. And what we are seeing in European countries confirms the information and the data that we had from China.
Thanks very much. Thanks very much, Katie, for that. So I go to the second question. This for you, Alana, and then maybe back to Katie with the second part of this question. This is from Moskovsky Komsomolets newspaper in the Russian Federation. The question is, the ecological situation in big cities is usually quite bad. Today, with more quarantine measures implemented, older people are bound to stay at home and have even less opportunities for physical activity. What impact will strict quarantine measures have on the health of older people in the longer term? Alana Officer, thank you for joining us today. I'll pass that question over to you, Alana. Thank you.
Thank you. Thank you very much, Rob. I mean, as we just heard from Dr. Kluge as well, the health, or the level of health that people had going into the pandemic has a huge impact on how well they recover. So we all need to keep physically active, even during quarantine. So regular physical activity helps both the body and the mind. So what can we do? We can try to reduce the amount that we're sedentary, so the amount that we're sitting for work or watching TV or even reading. Get up at least 3 minutes every hour. Use your household chores to be more physically active. It's really important to set up a daily routine and even have a daily goal, like 30 minutes of physical activity a day. If you can be active with family and friends, fabulous, we need to be doing that. If you can get outside, if that's permissible, walk in the park, do that. If not, join an online class or choose your favorite music and dance to that. So it's really important for older people to keep improving strength and to improve balance. There's many activities that they can do at home to maintain their strength and resistance. And making time for physical activity is really important. There's great guidelines on the WHO Euro website that can be consulted for maintaining physical activity. So really, if we maintain our physical and our mental health, there is very unlikely that we'll have any long-term side effects as a result of quarantine. Thanks, Rob.
Thanks very much, Alana. And the second question, also from Moskovsky Komsomolets newspaper in the Russian Federation, maybe for you, Katie. There are several hundreds of volunteers in Moscow trying to help older people, for example, to deliver them some goods from supermarkets. But are the quarantine control measures enough to guarantee that such volunteers won't spread COVID among older people who are more vulnerable to the infection? What's WHO's position on this? What control measures for volunteers should be implemented? Katie, please.
Thank you for the question. Yes, it's a very good one. And of course, we really encourage these community movements to help and protect our most vulnerable populations. And here I'll reflect again the words of solidarity, but also collective responsibility here among our communities. We can all do our bit, and a little help can go a long way, especially for those who are vulnerable, who are alone, who may have lost the social networks that they had in place previously because of the demands that we are placing on people to take quite radical measures to their own lives in order to be protected. So absolutely, we welcome volunteers, we welcome people reaching out to their neighbors, especially to those who are particularly vulnerable, who are older, and having a friendly person to help with practical issues such as shopping, such as picking up crucial supplies, is going to provide a huge amount of comfort. And indeed, even just having somebody to talk to. But it is very important that those who do volunteer do not put vulnerable people at any additional risk. We need to shield them. So please be very careful, practice physical distancing, communicate with them, do as much as you can remotely. And when you're taking shopping, please comply with both the local regulations and also what we know works in terms of keeping a physical distance from people who are either vulnerable or unwell, making sure you also wash your hands, keep your own physical distance, and certainly if you are sick or you have been in contact with anyone who may have had COVID-19, please stay away from people who are vulnerable.
Thanks very much, Katie. And there was a similar question, and it was specifically for the RD that was posted on Facebook on older people rely heavily on a workforce that might be affected by COVID-19. How do we ensure that older people are protected from transmission from the workforce they come into contact with? Would you like to add anything to what Katie's already said?
Absolutely, because this is very close to my heart. This goes to our heroes, the frontline people. It are mostly nurses, informal carers who take care of our elderly people, both from the health, social, informal sector. Those people who are giving every single day the best of themselves. So the protection of the healthcare worker is linked with the protection of the elderly people. We need to provide the tools to our health and community and social workers, right information, right training, and of course, very important, the personal protective equipment. There is guidance on this one that WHO Regional Office for Europe has issued, how to ensure the essential health services where the workforce is really part of it. But once that the COVID-19 will be behind us, we should not forget about this. Because now there's a lot of appreciation to the nurses, the doctors, the healthcare workers, which is rightly so. But we were advocates of nurses and midwives before the COVID-19 started. And we have to continue because many of those people suffer because the public budgets were cut and undermined in many countries. So this is a very important, painful reminder. Do not cut on the essential public health and healthcare services, of which the workforce is our gold.
Thanks very much, Hans, and thanks very much, Katie, for your responses. So the next question is Komsomolskaya Pravda newspaper in the Russian Federation, and it's for you, Katie. During quarantine measures, many older people are moving away from cities to their summer houses. Is it safe for them to walk outdoors there? Maybe we'll take that question. There's a couple of questions from the same outlet here. Did you get that question, Katie?
Yes, I did. Thank you. So is it safe for people to walk outdoors? So older people, just like all of us, we all need to follow the recommendations and the advice that we are provided. And in that sense, we all need to behave responsibly. If allowed, as was just described, going for gentle walks is certainly a good way to keep healthy, to get some exercise, and to preserve our mental well-being. Remaining cooped up at home is challenging for all of us, and especially for those who are older. But at all times, and especially where COVID may be circulating, if you are allowed to go for regular walks, please make sure you keep to the basic principles of good physical distancing, good hand hygiene, and do not go outside if you are ill. You must remain isolated at home. This is incredibly important.
Thanks very much. Thanks very much, Katie. And to keep you on the spot, if I may, with the second question from the same outlet, which reads, many older people are sure that if they get COVID-19, they will definitely die. It's certainly not the case. Can you give some positive statistics or advice that can help older people to understand the real situation? We heard a little bit about this in the regional director's statement, but maybe you could elaborate, Katie. Thank you.
Absolutely. And no, it's not the case that everyone who contracts COVID-19 will die. We know that there is a higher, what we call case fatality rate in those who are older, and we've been through the reasons for that. And we do know that a very large proportion of the deaths that we have recorded from COVID-19 are among the older age groups. But we also know that the case fatality rate changes. And we know that even though it's much higher in older age groups, it's still not everyone will die. We have from data from a large number of Chinese cases that the case fatality rate in people aged over 80 sits around 15%. The other 85% will go on to survive and come out from the disease. The same types of information we're seeing now from European countries, where we're seeing the same percentages that the case fatality rate among people in Spain is really around 10% between 70 and 79-year-olds, and goes up in the higher age groups from those who are over 80. And we're seeing similar percentages from Italy and from other countries. So older people can seek information from their local health authorities. It's very important that all of us understand what our options are for treatment, that understand what services can be made available to us. And certainly you should consult with your local health providers, you should consult with your families and your close ones about how you, as older people, would wish to be treated.
Very good. Thank you very much, Catherine. And the next question for you, Manfred Huber, joining us online. Manfred is the regional advisor here at the WHO Regional Office for Europe on healthy aging. This is from Natalia Bushkovska from Ukrainska Pravda, excuse me for my pronunciation, in Ukraine. And the question for you, Manfred, is what recommendations can you give to lonely people who are self-isolating? Manfred, please.
Thank you, Rob. Well, beyond the social connections, it's really important that all of us try to stay as much as possible and keep a personal daily routine, or even to create new routines in these changing and challenging circumstances. For example, it really may help to find activity for yourself that are interest or fun. to find activities that help keep us physically and mentally healthier. We all know staying active will improve mood and how you feel. And of course, it also helps to keep regular sleep routines and eat healthy foods. Now, there's also one important aspect for mental health and well-being. We all see these days there's a near constant stream of news reports on the pandemic, and this can cause additional feel of anxiety and despair. So one advice is seek updates maybe at specific times of the day, but overall minimize watching and reading and listening to the news on COVID all over again. Thanks.
Yeah, thanks very much. Thanks very much, Manfred. And you talked about communications. Maybe this is a question for Alana. One of the problems in all countries is communication that is understandable to older people or those with cognitive impairments. What measures can be taken? Alana, can I pass that question to you? Thank you.
Sure, Rob. Thank you very much. It's a great question, and it's really, really important. There are a number of specific considerations that we can make to ensure, for example, that older people with cognitive impairments can access the information. Firstly, share simple facts on what is going on and really clear information on what they can do to reduce infection. Repeat those messages as often as is needed. You can display information around the house in pictures or in writing that can remind them of this changed situation and what they need to do. It's important to assist the person to keep their regular routines and schedules, whether it be getting up and doing daily chores, physical activities, singing, whatever activities it is that are important to them. And those activities we can prompt by making a phone call, a neighbor or a family, to the person concerned. Clearly, if the person is feeling anxious or stressed, then more practical or emotional support may be required either through families or through health or social care professionals. Thanks, Rob.
Thanks very much. And a related question back to you, Katie, on this. What's your point of view on leaving COVID-19 suspected or confirmed patients at home with their families? It was from the same source. So what is your point of view on leaving COVID-19 suspected or confirmed patients at home with their families? Katie, please.
It's a very good question, Rob. And WHO's position here is that all COVID patients should be cared for in health facilities if possible. We're very aware that the huge surge in patients in hospitals can cause very big issues in terms of being able to manage all of the cases in hospitals. So certainly there needs to be a prioritization of those who are hospitalized. And where there are big problems with surge on hospitals, milder cases may be managed in other facilities, sometimes adapted facilities, sometimes hotels, areas that are specifically designed to deal with milder cases. And sometimes, if the patients can be isolated at home without coming into close contact with their family members and without providing a route for the virus to continue spreading, they may be managed at home. But that, of course, needs to be done in tandem with the needed care that those patients would have to have. So first of all, we would recommend treatment of all cases in health facilities. When it comes to hospitalization, we would really recommend that we would hospitalize those who have any probability of having a poor outcome. That is, patients with severe and critical illness, or those who at the beginning of their disease may have factors that could contribute to a poor outcome of disease, such as age, but also comorbidities such as chronic cardiovascular diseases, chronic respiratory diseases, diabetes, and cancer.
Thanks very much, Katie. A question now in from Kostas Davanis from the Hellenic Public Television ERT in Greece. I think you've covered this slightly, Alana and Manfred, before, but I wanted to pitch it to you anyway, and maybe we could start with Manfred and then go over to Alana. There's a question: older people, especially in Southern Europe, such as Greece, feel very strongly about being confined to their home because of the good weather, the mentality of everyday human relationships, and the need for constant communication in these countries. Can we prevent feelings of loneliness, despair, and fear of passing away, and how? So this is more about the mental health and well-being of older populations. Maybe Alana first, if I may.
Sure. I mean, Kostas raises some really important questions. I think the importance of, and we've heard about it a bit before, in terms of staying socially connected with friends and family being really important. Just stressing that physical distance isn't social distance, and that's really key. So creating opportunities really whereby people can continue to find activities that give them pleasure, that they can delight in, finding, Manfred also mentioned, looking after your health, maintaining specific routines in terms of eating and healthy food. They all help a lot. Finding those things that give you joy and investing in those activities that bring you pleasure are really important. Being aware of the facts. I mean, Katie's just talked very clearly about the facts around case fatality in older people. Understanding that there is not reason for despair in this situation. There is a lot that people can do to protect themselves, to keep themselves physically and mentally healthy and engaged. And that's really important in these times to do that. Thanks, Rob.
Thanks very much. Manfred, did you want to add to that?
Yeah, that was very comprehensive, but maybe we can look a bit at the broader picture. I mean, there's a saying, if you have a crisis, never miss to learn the lessons for the future. And in this very specific situation, if you look in Greece, if you look how some people live on the islands, I think what we can learn is that where we now have seen strong social networks, but that are greatly currently hampered by quarantine. I mean, social networks of support for older people in the community, by friends and families. Now we should think ahead on how can we in the future complement these social networks from families and friends by having, in addition, institutionalized services. There needs to be a basic social service that can reach out specifically for those that will anyway be lonely, even before the crisis, because they don't have families, because they live remotely. And I think what we should now learn is our lessons on how can we better than complement the great job that families and friends are doing. And here also, let's not forget that social services are often very unequally available in countries, and especially those living in remote rural areas will find it much more difficult to access services. And certainly that's also the case, for example, if you go to islands in Greece. Thanks.
Thank you very much. Thanks very much, both Alana and Manfred. A question for Katie next from Kommersant newspaper in the Russian Federation. It is known that some countries exclude from COVID-19 statistics such as death cases that can be explained by other causes. For example, by heart failure or cancer. Does WHO give consideration to this process? Is this reflected in the WHO statistics?
Thank you, Robin. Yes, as countries really set up their systems to collect information on COVID, which is, as we've said repeatedly, a new virus posing huge stress on our public health systems, there will of course be slight differences in the way different countries collect information, classify data from COVID patients. And that's really why we've highlighted that in comparing country to country, we must be very aware that there may be hidden limitations and differences behind the data. That's why it's very, we have to be very cautious when we look at different figures on, for example, deaths from one context to another. There's differences potentially in the way data is collected, but there's also a huge range of differences in the way measures are applied, in the way countries are putting together their interventions, and the demographics of the disease and the way the disease is spreading. So there are so many different factors present in different countries that it's very difficult to compare one country to another.
Thanks very much, Katie. And now back to our studio here and to Hans, the regional director. A question on what is the impact of overweight, obesity and diabetes on COVID-19? Hans.
Right. We know that people with diabetes have a more severe course and worse outcomes when they have COVID-19. In fact, in Italy, 1 out of 3 patients which had the diabetes, but this is not only diabetes, in fact, it's non-communicable disease in general. Non-communicable diseases is a terminology we use for chronic diseases like diabetes, cancer, chronic respiratory diseases. The same for the overweight. I think this was very clear from data in China. It comes back to what I was telling earlier on. Stay healthy. The more healthy you enter into the infection with COVID-19, the better. And that's the core of everything almost we have been telling here. Everything with a pinch of common sense. Not a few, not too much, and to stay connected.
Thanks very much, Hans. Katie, back to you. Pharmaceutical Herald Weekly asks, should patients take antiviral treatment immediately after the onset of symptoms or a positive corona test?
Right, we caution against taking any antivirals without being prescribed them by medical doctors. So please do not go ahead and self-treat yourselves. Follow the advice of your medical professionals where you live. In terms of the provision of antivirals, we don't have the evidence yet as WHO to say authoritatively what works and what doesn't. Certainly, supportive care is essential for those who have severe disease and are in hospital, and that is being provided. At the same time, hundreds of clinical trials are being run right now with patients enrolling to understand better which of the antivirals, either taken as specific medicines alone or in some combinations of antivirals, can work in the best way. And in that regard, there is a trial ongoing that is led and coordinated by WHO called the Solidarity Trial. This is ongoing, including with many enrollments from member states across the European region. And we're now seeing patients being enrolled into these trials. It'll be weeks. These trials will move quickly. It'll be weeks before we will see really the results. But we hope that within several weeks, we will start to see more information about what has worked in patients. And then we'll be able to say with a little bit more authoritatively to health providers how they should be treating patients with specific antivirals or not.
Thank you very much, Katie. A question also that's come in for Hans. What are the gender and equality implications related to the finding that people with non-communicable diseases have higher risk of becoming severely ill or dying from COVID-19?
In the European region, in the whole region, we know that males are slightly more infected than females. And from the early data coming in from Italy and Spain, if we look at mortality, hospitalization, especially in intensive care units, their male is much more than the female. Why this is being investigated? A potential factor underlying cause is the higher prevalence of risk factors for non-communicable diseases, like, for example, smoking and younger age. On the vulnerable populations, there is a huge, what we call inequities in the distribution, the prevalence of chronic diseases, that the vulnerable people are more prone to non-communicable diseases. and also a bit more tough to implement physical distancing measures and other policy options. It comes back to the core of the mandate of WHO, of the Vision for Europe on leaving no one behind, that we have by hook and by crook to implement not standard solutions, but solutions which particularly pay attention to the more vulnerable in our society, including also migrants and refugees.
Thank you very much, Hans. And there's one more question here, which I think also has come up a number of times, but it's been posted just now, which is, can you give some guidance so older people, especially those in lockdown and practicing physical distance, can stay healthy, how they can stay healthy? But I think, Manfred, you've already answered that. Unless Alana, I'm looking up to the screen here, unless Alana, you'd like to add anything to that. We can't hear you. Sorry.
I think Manfred already covered sleep, physical activity, nutrition. These are all important. And clearly, really key is staying socially connected.
Absolutely. Thank you very much. So we're going to now move away. We see some questions coming in. They're moving away from the focus in terms of older populations and COVID-19. The first of these, there's just 2 or 3 of them remaining for us now. The first of these is to Katie, and it's from Kostas Davanis from the Hellenic Public Television in Greece. How long does the coronavirus remain active on surfaces we get in contact with? Thank you.
Thank you. Very good question, and a question that comes up again and again. And just with the caveat that we're still learning about this virus, and every day we find out something a little bit more, and we're getting to know each other slowly. So far, studies suggest that coronaviruses in general, but also based on preliminary research on COVID-19 virus, show that it can persist on surfaces for a period between hours up to certain days, but it's very difficult to generalize. And this really depends on the type of surface, the temperature, the humidity, etc., etc., etc. So it's very difficult to say. The most important message here is that although the virus may be able to persist, it's very easy to clean it off. And wiping surfaces with a simple disinfectant within a minute will kill the virus and very successfully remove the contamination. So be sure to wipe your surfaces regularly, clean your hands with an alcohol-based solution, or wash them with soap and water. And let's stick to what we know works.
Thanks very much, Katie. I'm going to keep you on the spot. This question is from Evie Phillips from the Cyprus News Agency. From the data available so far, does it seem that the danger of increased mortality from COVID-19 concerns not just older people, but also middle-aged people in their late 40s and 50s? For example, in Cyprus, there have already been 2 deaths of 2 males aged 47 and 51 with no underlying medical history. Also, how effective do you believe restrictive measures of circulation are that have been taken in many countries, and how long should they be in effect for? So there's one question there with regard to the age groups affected. The second question regards the measures undertaken by countries to lower the curve, as we say. So maybe you could take both of those questions, then I might ask Hans to make a few comments on the second one in terms of how long do we keep these measures in place. Catherine, please.
Thank you, Rob. So yes, as we've heard already, older people are more at risk. And yes, other age groups are at risk too. And certainly most of those who have had severe disease or have unfortunately died because of COVID-19 have had underlying conditions. There are, of course, exceptions to all of this. And we still need to understand why those exceptions are taking place. And again, coming back to the fact that we're 3 months into this virus, it's completely new, it's a new pandemic, and there's a lot to understand. But broadly speaking, when we look at the trends in terms of the large numbers of cases that we're looking at, and when we look at everything, the trend is that most people will have a mild self-limiting disease of approximately 2 weeks. but other groups, and particularly those who have these risk factors, i.e. age and underlying conditions, may go on to develop severe or critical disease. In terms of what WHO recommends in terms of steps by countries, it's very clear, and it's a comprehensive set of measures. And we need to apply measures in parallel and based on the epidemiology in the context that's given. So that includes our classic disease control measures, identifying cases, testing them, isolating them from other people who are not ill, and also following contacts. And this is really important. Those can be complemented by additional public health and social measures that involve physical distancing and slowing and delaying the spread. But we must not forget the importance of the classic disease control model. Without that, countries will not be able to suppress the virus.
Very good, very good. Hans,
just
would you like to add? Sorry, go ahead.
Just end, Rob, that underlying all of this is the huge importance of community engagement. We need buy-in from communities, we need solidarity, and we need collective responsibility.
Great, thank you. Thanks very much. Thanks very much, Koti. Hans, would you like to mention or add to anything regarding the measures and when they should be removed, was the question.
That is a big question. It depends in which phase of the epidemic, the pandemic, the country is. We cannot generalize here. It's a question that we're getting from more and more countries, and we're working very fast and speedily to have some scenarios to guide the countries. But let's not forget that in many countries, we're still in the acute phase and still focusing on the same time on preventing, but also saving lives. What we know is that we may anticipate once that the restrictive measures are loosened, it will be done in a gradual way, and there may be a second or a third wave to anticipate, but it should buy us time for the hospitals to be ready, and the non-pharmaceutical traditional public health measures which have been put in place should further be adhered to. So it's really a collective responsibility.
A collective responsibility. On that note, we're going to close today. I'm going to close by thanking all of you for joining us today on this virtual press briefing and joining us on Facebook Live. Please stay tuned. We'll be back next week with another press briefing that will be announced on our website. I'd like to thank Alana Officer, Catherine Smallwood, and Manfred Huber for joining us on the panel. Of course, our own regional director, Hans Kluger, as well, and the team here who made this happen. Thank you very much. Take care.
Thanks, Hans. Bye.